survivor. I just went through a battle of fourth stage cancer. I have several experiences with medical staff as well as healthcare facilities and accessing interpreters. One thing that I advocate for myself is to ask for in-person interpreters when I'm accessing healthcare. It is a better approach for myself than the video remote interpreting. The video remote interpreting usually freezes quite a bit, and it's difficult to see the interpreter on the screen that they provide. Having an in-person interpreter, you have access to 3D spatial information that you would not have access to on a 2D screen. So it is vital for me to have, for my healthcare needs, it is vital for me to have access to all information. Anthony speaking. Thank you for sharing, Michael. Before I move on to the next person, I wanted to make sure that everyone is okay with the recording today. We are recording this session. Are we okay? Okay. I saw several head nods. Yes. Now we'll move on to David Lurman.
David, we can't hear you. You're on mute.
You'll need to unmute.
I'm sorry, David Lurman. I'm with the HLAA Kentuckiana chapter. I am the newsletter editor and board member. Are you everybody hearing me okay? Are you hearing me?
Yes. Yes.
Okay, all right.
Anthony,
go ahead.
Yes.
Okay. Okay.
We'll go to Will Fritz next.
Okay.
Hello, everyone. My name is Will. I grew up here in Louisville, Kentucky. I went to the Louisville Deaf Oral Preschool program. I am currently employed here in Louisville. I have epilepsy, and my epilepsy requires me to visit medical staff frequently. I've had interesting experiences with that, and I am happy to be here to share my story. Anthony speaking. Thank you, Will. Now, Patrick Hughes, you're up.
Hi, I'm Pat Hughes. I'm with the HLAA Kentuckiana chapter. I'm also the treasurer for the Walk for Hearing that we do every year. And I've had hearing loss for some time. In the early 80s, that's when I first got my hearing aid, some kind of hearing aid. And successfully throughout the years, I've had more powerful, and eventually had very powerful hearing aids and still had a lot of difficulty hearing. So after an accident that I had in 2010, I wound up in the hospital and had a lot of problems hearing. It was my surgeon who actually set me up for a cochlear implant. And about a year later, I've got that. So I'm retired. I'll just let you know.
Anthony signing, great. Thank you for that introduction. Now we'll move on to Makai Lombardi. And this is Makai speaking, and there's no L in my name. Hi, I'm Makai, and I work at Heiser as a targeted case manager currently. Let's see, what else would I like to add? I am a deaf individual, and I do have experiences with patients that have had their struggles going through healthcare services without access to communication. I help the people that I work with advocate on their own behalf, and I've experienced being a patient myself. Anthony speaking. Thank you, Makai. Now, Judith.
Yes, this is Judith speaking. My name is Judith Gaddy. I am a certified peer support specialist, now with 7 counties at the Child and Family West outpatient office, where the Deaf and Hard of Hearing unit is also currently housed. I just started this job about 3 months ago, and I had hearing loss in the 70s in high school that resulted in me having surgery to repair a bone in my inner ear, and then my hearing was restored so well that I forgot for many years that I had experienced hearing and sight problems. When I returned to the United States about 6 years ago from the Peace Corps in Mexico, I noticed that my hearing was going in that ear, and I eventually moved here to Louisville, Kentucky, where I was diagnosed by Heiser Hearing with a significant loss, and I was fitted for a hearing aid, which I've been wearing for the last 6 or so years, but I'm coming late to this whole experience, and I also am not familiar with Louisville, so I didn't know about a lot of the organizations that might exist. And I have had many struggles with health issues and not understanding, or I thought I heard what the doctor said. I'm currently in a situation like that, but that's enough for now, and I'll share more on that later if there's time. But thank you. I'm glad to be here.
And we're happy that you're here too, Judith.
Thank you.
Let's see, Holly Evans. Hi there. Hi, Holly. Holly, this is Holly Evans here. I am deaf. I do have a cochlear implant as well. I've been deaf since I was like 4 or 5 years old. I have 2 kids. I'm a mom. I have a lot of medical appointments for them. So I have to deal with interpreters, like, giving birth, being pregnant, requiring interpreters at that point. So I've had that experience. I've had some allergic reactions while I was pregnant. So going to the doctor, I've had some situations and some issues. So I'm so happy to see everybody today. Excited to be here. Good, thank you. Thank you all for your willingness to participate today and come and share your experiences. I really do appreciate you all being here. I want Laura to be able to introduce herself. She's the manager for the IC, Independent Community Impact Council. So Laura, if you could introduce yourself.
Yes, thank you, Anthony. My name is Laura Chowning. I've probably emailed with each of you as you've signed up for this listening session. So we thank you so much for being here today. I do work for WellCare Health Plans. We're one of the Medicaid providers for the state. And in that work have been very blessed to work alongside a number of community partners as we've developed this council, the Community Impact Council with the deaf and hard of hearing. And so today's goal is to hear from you, to hear from individuals who have lived experience accessing social services and healthcare services. And we hope that you will be very open and candid with us as you share your stories. And I'll turn it over to Anthony as he facilitates our work group.
Great. Thank you, Laura. Thank you for that. Okay, so now I guess we're going to go ahead and start with the questions. Yeah. Let's do that. So the first question is, if you want to just kind of raise your hand to who wants to start with the first question, who wants to answer the first question. But the question is, I'm not sure who would like to start, but what is a healthcare or community resource experience that you would like to share, whether it's positive or negative?
Hi, I'm Pat. Oh. Can everybody hear me?
Yeah,
Should I
I'll
say
just read it
hi?
one. Yep, I'll read the question just one more time. What is a
Okay.
healthcare or community resource experience you would like to share, whether it's positive or negative?
An interesting, this may have been experienced by many people. Several years ago, and I usually have what's called a wellness check once a year. That's something that Medicare pays for. And I noticed one time especially that my doctor, as he was asking questions, he was constantly looking at a computer screen. It's a portable thing that on wheels, and he wasn't looking at me throughout all the questioning. I thought about that later and decided that won't happen again. I will tell him to talk to me directly.
Okay, I'll go ahead and share an experience that I had. Am I the only one speaking right now? It looks like I am. Pat, am I the only one speaking?
Yes, you're the only one speaking.
Okay, all right. Kind of taking off on what Pat was just talking about, just kind of like a personal experience thing. Mine has to do more with self-advocacy in the operating room. My experience was as I went in for an open heart surgery a few years ago. And I wanted to make sure that all the personnel within the operating room were aware that I had a severe hearing problem. So I made sure that all the people in that operating room knew that. And I specifically asked them to speak into my left ear, which is my better ear, clearly and concisely, so that I can be able to understand whatever's needing to be said to me during the operation. I'm very glad I did, because during that operation, I was in a situation where I was gagging very bad and woke up from the sedative. And there was one male person who spoke very clearly and calmly, just breathe normal. And those were great words for me to hear. And that really calmed me down immediately from coming off of the table there. So I just want to pass that on, that make sure that you know that everybody in a situation where your life is at stake, that you have communicated your needs to them. Don't ever forget that, please. That's all.
Anybody else want to share? I think that this has been a conversation, especially since COVID. More people in, the medical field are beginning to understand the need for that lip reading, or to make things more clear, like how they speak and what they say. Having the Zoom appointments, having captioning. I think those are some of the improvements that are being made that can continue to still be made. I remember one time, some time ago, I was getting a hearing test done, right? I went to like a normal doctor's appointment, and of course I failed the hearing test. So obviously I have to make another appointment to go to the audiologist. I called one of them, and they refused to provide an interpreter. And I was like, no. And they were like, well, I'm the mother, like that's my child. Like I have to have an interpreter to go there. So the expectations were a little bit different, and the reactions for that appointment. So they needed training after that, obviously. But I say that because I had to end up contacting the Kentucky Commission on the Deaf and Hard of Hearing. The audiologist was very willing to provide the interpreter. So we found one that could, but we had to call around though, like 4 or 5 times, because they were all turning us down for that. And they would say things like, well, like we know a little bit of sign, or he knows a little bit of, no. And I was like, that's not going to work, right? The hearing test. Let the interpreter do their job, you do your job, right? So anywho, I'm thankful that he passed and everything, but there's a situation where having that back and forth with them about the interpreter can be very frustrating. And they know that, deaf parents have hearing children, right? And so having to go back and forth with them, to go back and forth for them to be trained to know that they should provide, yeah, that's just frustrating. I had an experience with an interpreter at the hospital. One time I was going in for surgery, and they scheduled surgery. I don't know, this might have been like a year or 2 ago. I can't quite remember, but it was at the Baptist East Hospital. I arrived. The nurse was already kind of stressing me because it was all this, like, hey, you're here for surgery and everything. And I was like, hey, where's the interpreter? The interpreter should be here for the surgery, of course. And they were saying, no, it's not my responsibility to call the interpreter, right? It's your job, right? Because you all have to do that. And my mom was going to be there for me. And, the interpreter should have been there to take care of that. So it's really important for all deaf people to really request during those kinds of appointments, surgery, anything where your life is in danger, where you're going to have someone there. It's more effective. The communication is more effective in the hospital that way, to set up an in-person interpreter. Going into the hospital under those conditions, and then having to deal with the video remote service, freeze framing, the digital access just doesn't come through as clearly as an on-site interpreter. On-site interpreters, that communication is so much smoother, right? And between the client and the doctor. And that's more of an equal access in that situation. And so I'm not sure who at the hospital, they have to talk to their higher ups there, or like the program admin people or what have you, and ask them, why. And I told them that I don't want to be RI interpreter for this situation. I want a live interpreter. So they had to call the agency and like have an interpreter come. It took about an hour, but still, right? But from there on, I felt like that's very important, and it's very frustrating to have to go and explain that to see. So anytime you schedule, they should be aware, or if not, you're going to have to let them be aware that you need an in-person live interpreter, right? And don't let them go through with saying that they forgot, or, you know, we could just do this, or, you know, if you have to wait, then we're going to waste your time and everything. And no, that's not it, right? It's just really, really important, but it can be very frustrating at the same time in the moment. Yeah, you're right, says Anthony. Okay. Of course, I have a story from back when, and if I can remember correctly, but there was a person who had some kind of emergency surgery that had happened, and both individuals were deaf. They were like a husband and a wife. The husband let the doctor know, I'm going to need an interpreter, like a live interpreter, because my wife is here, and this is an emergency situation, and having a live on-site interpreter is going to be very, very necessary. The doctor was not willing to listen. During the surgery and everything, that all went through, and then afterwards, so the surgery was not successful. And yeah, it was not successful. And you know why? Because there was no interpreter there. Because the patient was having a hard time breathing, and they were having a hard time communicating with the interpreter while this emergency was happening. So again, this is when it's important to have those on-site lab interpreters, right? Because you never know what the patient could be asking for in that moment, in that situation, and having them try to comply and listen. You don't want to risk someone's life, right? For no interpreter, for lack of access of communication. I think that one other thing that I would like to add to the video remote interpreting is that you're going to hear this a lot, the freeze framing and the digital pixelation that happens, especially in the hospital. It's just, it's horrible. There has to be some kind of way that there's a firewall that is separate from the hospital that can support the communication of the video remote. So it can be a much smoother quality of a picture or a connection, or what have you. I think that's where you'll find the difference with the VRI, why we're having so many problems with that.
Holly speaking, there are some situations where VRI could be acceptable. I'm sorry, Laura's made a comment. I was going to read that. Oh, okay. Yes. And Makai's saying, I didn't mention any names though, and Holly's now saying, are you ready for me now? Okay. My daughter had a follow-up appointment for her arm, and it was just a follow-up appointment. They brought in VRI, and the appointment was just to take her cast, remove the cast from her arm. We had already been through the situation, so I was very aware of what was going on. So I'm not an advocate of VRI. However, there is times where it is appropriate. If it's a shorter appointment where the doctor's going to come in and do their thing and leave, and you've already had the experience, it could work out for that situation. So I'm not 100% against VRI. Again, when I say that, there are times where it's appropriate and can be very beneficial. Now, I've had an allergy appointment follow-up, and they brought in VRI, and in the middle of the appointment, the VRI quit working. So you know what the doctor did? Just hopped up and walked right on out of the room. And I'm like, okay, so I'm supposed to stay here. I'm here to visit you. Now it's my responsibility to get access through the VRI machine. And I literally had to ask them to come back in and operate their own equipment. So yes, VRI is a lot about educating the facilities when it's appropriate, how to use it. And if the person really does not want to use the service, go ahead and get an in-person interpreter. And that's my 2 cents for this topic. Anthony speaking. Before I move on to Judith, I want to emphasize that you cannot, please do not share someone else's experience. And I know I know that you would like to without names, but we still don't want to share anyone else's experience. Please make it be your personal experience. So I will go to Judith. Could you hold just a moment, Makai? Judith?
It's okay with me if Makai, this is Judith speaking. It's okay with me if Makai wanted to respond to that correction that you made. And then I'll speak after that. Is that all right?
This is Makai speaking. Yes. How can I share, or how can I, let me see how I want to ask this. How are we going to learn if we do not share experiences from other people that may actually be worse than our experience, or I may not have a personal experience, and I just feel like that it would be beneficial to this conversation if I share their experience? Anthony speaking. I understand where you're coming from, Makai. The agreement was for people that were to join this conversation were to share personal experiences, and others will have opportunities to share their personal experiences, but we want to make sure that what we're sharing in this space today is our own personal experiences. Okay, Judith, go ahead.
Okay. This is Judith speaking. I can really relate to what Makai is saying because I think I've had so many experiences. It was kind of hard, some positive, some negative. It was very hard to bring them to the surface and talk about them. So in fact, I wasn't even quite sure that I had an experience until I kind of paused and thought about it, because some of the things that have happened to me were kind of traumatic and stressful. So I buried them and didn't want to talk about them. So, like, for instance, when I was in high school and it became apparent through my interactions with a cousin that who's my same age, that I turned my head to listen to her every time she spoke, and I didn't know that I wasn't hearing in my left ear, and no one in my family noticed it, and it had never been diagnosed by any doctor, not at school, nothing. And I've been told at one point that I didn't speak until I was about 2, but yet no one thought this was odd or anything. So I went on to really excel in school, and I guess it was just overlooked. I was working really hard to hear and listen, and I'd often sit near the front of the classroom just to comprehend, and I would work. It seemed to take me a long time to complete things, and so I stay up really late at night studying. Well, I went to the first doctor we went to about my hearing, and I just can't remember if I was like somewhere between 14 and 18 years of age. The first doctor that we went to said, well, you have a progressive hearing loss, and it's just, you'll probably be deaf in both ears, and we'll just fit you for hearing aids on your glasses. And I had just gotten glasses at age 12, and they were very thick. And back then they you'd have these, what were called Coke bottle glasses. And then with hearing aids on the end, I just thought my life is over. I just couldn't even see living that way. There was no one around me who had been diagnosed as hard of hearing and I felt really alone. Well, my mother happened to mention this to someone at her job who knew of a different doctor, and they sent me to this doctor, and he decided that I had otosclerosis and that he could do surgery, but he'd never tried it before, and he was going to experiment on me, and so therefore it would be free. And now I know that this happens a lot to African Americans. You've heard of the mortal Henrietta Lacks or other stories that are coming to the forefront now about how we've been used in experiments. Well, it was extremely painful. I wasn't really prepared for everything I had to go through, and it was a really traumatic experience. Eventually, after I healed, my hearing loss went from about 60% loss to about 2%. And I just like put everything out of my mind and just tried to pull my life together and go on to college. I was fortunate enough to be going to a private prep school in Indianapolis. I was a scholarship kid, and I tested well. And I also had early admittance to Harvard in Cambridge, Massachusetts. So I determined to just go there and act like I'd never had a problem. And I didn't get help there, never said that I had any hearing issues, never said I wasn't really understanding what was going on. They never assisted me at all with that. I did have some problems with my classes and needing extra help. And it was always like, you're not working hard enough, or we don't understand what's wrong with you. No one said, is it possible that there's some other barrier? So fast forward many years, the hearing situation held up very well. I couldn't completely forget about it. The sound in that ear was it could be very tinny, very odd sound. And sometimes I would get tinnitus or tinnitus. And also that ear would hurt sometimes. And eventually I also started having jaw problems. I had fallen on that side as a child, and it's possible that all of this is from that, but who knows? Long story short, and I appreciate your long attention. I noticed my hearing was going again while I was out of the country from 2014 to 2016. And I was in Mexico, and they didn't do an official hearing test, but just enough of just like a visual test. And they said, well, something's going on, but you're towards the end of your service. So when you go back to the United States, get some help. So I ended up coming here about a year or so later after being in other cities. And I was having trouble getting a job despite I had also gotten a master's degree later from Harvard. And I've been a public servant for most of my life. But I was having a lot of trouble getting a job. And it was here that like a workforce, Kentuckiana Works kind of place decided to send me to vocational rehab. And vocational rehab sent me to Heiser. And that was the beginning of my journey to have a hearing aid. So it became obvious that I had a hearing loss to people, and I began to be treated very differently. And also it affected the way that I really couldn't hear anyone on this side, and I wasn't sure what direction people were talking from. I went through several years with Heiser of trying to get the right fit, trying to understand why it's like my whole life had just changed, and no one seemed to understand this. Eventually, I got a therapist there who helped me a great deal and began to help me with the intersection of mental health issues, because of course I'd become very depressed over time, and the intersection of that with hearing loss. At some point, I also asked if I could just have the surgery again. And I was sent to this different doctor. He was very, he just brushed me off. And he said, so I can hear and I can read lips a little bit. And I do understand a teeny little bit of ASL, but I generally will just speak and talk with people. But if they're not right in front of me, or if they don't alert me that they're talking to me, I'm out of luck. So I get sent to this guy, and he was an older fellow, and he, remarked that he was surprised that I'd even had that surgery given my age. That given my age, he wasn't going to do it again. It would be too much of a risk. So the hearing aid's working fine for you. You just keep up going with that. That was devastating. Went back to all kinds of stuff. I had an experience one time at Norton where my right ear, my good ear, I couldn't know. I had like there was some wax buildup, and they had attempted to take it out in the doctor's office, and they flushed it with this hot, heavy like stream of water, very hard. And I screamed and kicked, and it was so bad, I thought they punctured my eardrum. So that happened. Eventually, I lost a couple of jobs because of my hearing. I've been mistreated in the workplace, on and on. But the most recent situation is that a couple of days ago, one of my doctors called with some test results and saying something about, because they said that I had 3rd stage renal disease, kidney disease. And I'm like, what? And it turns out that I'd gone to a specialist. I was there. She claims that she told me this. I have no recollection of that. I didn't understand that. I think someone on this call said that they're like looking at their computer and they're talking. She had somebody else in the room who was typing stuff too. She claims that she told me. I thought if I had been told that, I think I would ask a lot of questions like, where did I get that from? Is this from one of the medications I'm on? I don't have high blood pressure. There's no one in my family that has this. So are you saying, I said, well, what's the worst stage? And this is all on the phone to a nurse. And she said, well, 5, and you're at a 3 now. Like, what? And so this just happened like 2-3 days ago. So that's my experience.
Yes. Oh, yes. Thank you. Thank you for sharing. Oh, thank you for sharing your experiences. Okay. Let's go ahead and move on to the second question. What experience have you had with scheduling centers? What's been effective and what has been not quite as effective? Related to some of I noticed that some of us have different diagnoses. And of course, that requires several appointments. So could you speak a little bit to how you get those appointments scheduled, how you request for interpreters, or how they may provide the interpreters? Would you mind to share some of your experience with that? Yes, Holly, go ahead. this specifically for people who are using ASL interpreters or just need communication, access to communication. This is Anthony speaking. Once you make your appointment, and now you've had that appointment and you need to make another appointment, do you typically call from your house, or do you let the front desk know while you're setting up an appointment? At what point in the process do you let them know that what your communication needs are, number one, and if you do need an ASL interpreter, how do you go about doing that? I know that there are standard appointments that we have, but if you do get a terrible diagnosis such as cancer, what does that look like for you all when you need communication access?
Well, I
This
think,
is Will, you said something about CART.
yeah, sometimes with CARD, it seems that the doctor seems to have an accent, right? So that's the only thing that happens with CARD. Sometimes if a doctor has a strong accent, then it's hard to make sure that it's going to come through clear on the card. So I have asked for that before in the appointment, because if I do like a schedule up for a follow-up, for example, and if I get a reminder for the appointment, that's another chance, another opportunity for me to say, hey, I need CARD at that time. So each time that there is contact made one way or the other, right, with the provider, I try to remind them of that. Okay, this is Anthony. Again, that repetitive that you have to do with them, right? That repeated, yeah, how does, I know, well, this is Will, I know, well, this is the thing. I don't want a miscommunication. So I feel like overly reminding them, you know, I don't know if I'm talking to the same person in the office or what have you, you know? So I want to just be sure that I'm not going to cause a miscommunication of some sort. Totally get it, says Anthony, totally get it. That's a similar experience, Holly. Will says, yeah, because I don't want to have to reschedule, that's for sure. Holly's like, yeah, you definitely don't want to have to do that. Holly. Same thing. When I try to make the appointment, I always ask for the interpreter on the onset of making the appointment. If I don't hear anything back about a confirmation, then I make sure that I do a follow-up again. And I tend to say, because I want to know which agency, because then at that point I can follow up with the agency to be sure that there is going to be an interpreter there. But you're right, you do. You just have to constantly remind them, like exactly what you said, like when you have contact, because that's a waste of my time to try to reschedule either because no one is there. So, you know, exactly. Michael. I always try to say in the doctor's office when I go to the front desk, I try to let them know. So remember, make sure I need an interpreter for the next appointment so they can put it in their notes, right? So they can have it there somewhere, because I don't want DRI. So I tell them to put that in my notes, exactly, on-site interpreter. So that way that they know, and this is their first reminder that they get before I've even left the appointment, for them to make sure that they know that I need it in my notes, that I want a on-site interpreter and not a BRI interpreter. So whoever goes in to look at it to make the appointment, or goes in to change the appointment or anything like that, then they know that they need to call an interpreter. So far, I haven't had that big of a deal with the doctor's office, but the hospital is another story, right? Because they require lots of reminders and they forget, and you have to like doubly and triply remind them that you need an interpreter. So again, one resource that I've looked at is making sure that they add it to the notes for every appointment that I have, to let them know that I need an interpreter, and that if there's any problem with the interpreter showing up or what have you, right? Because then at that point, it's like there will be or there won't be an interpreter, because I'll say, did you all call an interpreter? If they say no, then I'm like, okay, then you all are at fault. Now I've got to reschedule, and it should have been in my notes. Did you all see it in my notes or not, right? So that's just one area that I think that, you know, that you could possibly do. Thank you, Michael, for sharing that. Thank you, Holly and Will, for sharing too. it seems like there could be some similar conversation that you all been having around that provider communication.
Does anyone from HLAA have an experience that they would like to share?
Hi, I'm Pat. I really, since I've got my cochlear implant, I'm okay with phoning in and hearing on the phone. So I haven't had problems since I got that. Might ask David if he's had problems on the phone with scheduling different things.
Oh, I echo what you say, Pat. I too have a cochlear implant as well as a hearing aid on my left side, but my hearing is adequate for phone conversations because of the Bluetooth coming in for the phones, and that's a godsend right there. Just the Bluetooth for phones is really great for those of us that are able to still hear, with aids. So so we're okay. I think more of the problems is going to be with the ones who have no hearing at all, that are going to need the interpreters, that are going to have the most problems to talk about right now. That's it.
Anybody else like to share? So look, Anthony, I know that you are the moderator, but I know you probably have some things that you would love to share too. So I know that there are some specific, as a dad for you as well, right? Going out there and you've had some headaches, obviously with interpreters too for your kids. And sometimes it's just like, just kind of forget it, right?
And I also, my children's father is hearing, and sometimes I send my kids to the doctor with their father, so I don't have to encounter their problems, and that's one way I can get around it.
Okay, so the next question that we have, maybe please describe your experience in a waiting room or at the front desk. What has worked and what has not worked?
Okay, this is David. One of the things I make sure of is I need to be able to hear when my name is called, when you're supposed to come back to see the doctor. So we have large waiting rooms that we can generally be in. Some are smaller, but I make sure that I am seated to where I'm facing whoever's going to be calling out the names, and try to be as close as possible to that door where they come out and call for someone. If not possible, if the room is too crowded to where I have to be far away, I would probably go get one of the desk assistants to tell them my name. And if they call out my name and I'm not moving, please come and get me. So that's what I generally do with whenever I'm in a doctor's office and I need assistance to get back to the room. That's it.
Thank you, Anthony. Now, Michael, I know that you had a comment, but let me share this. Before you make a comment, if you don't mind to raise your hand, and then I will call on you to make your comment. So let's move on to Michael. And Michael, you wanted to share something? Let's see. Yes, when I first go into a doctor's appointment, of course, you have to go up to the front desk and let them know your name and what have you. And oftentimes they ask you the purpose of your appointment. And then I will ask if an interpreter is here yet, or if the interpreter is expected to be on the way. And if the interpreter isn't there, I will let the front desk know where I'll be sitting where I'll be sitting in the room. And once the interpreter arrives, they can notify the interpreter where I'm at in the room. And typically the interpreters will come over and sit in my vicinity. So when they come out to call names, the interpreter will let me know that my name has been called. Now, once I'm done, the interpreter is going to fix the error. If without the interpreter, I have experience where they have come out of the room and have called my name several times, and I haven't moved. I haven't moved from my spot because I can't hear. But it's a lot easier when there is an interpreter in the room, because when they come out of the door, they can typically see that I'm communicating with the interpreter and see us signing. So it's obvious that I'm the deaf individual in the room, and they can come over and alert us that it is my turn to go back to the back. So yes, that's why it's an ideal situation to have the interpreter there before the names are called. Thank you. Did you have another story you wanted to share? No, no one else? Okay. We will move on to the next question. What are some challenges you face with doctors, specialists, and the hospitals? And how do those challenges specifically affect your personal health? Would anyone like to share? I'll repeat the question. What challenges have you faced with doctors, specialists, or hospitals? And how did those challenges affect your health? Yes, Judith.
This is Judith. I think I shared several when I gave my experience in response to the first question. So in other words, I may not have gotten proper direction while I was being operated on. I also may not have fully understood how much pain I would be in, or how long my recovery would be, or what other options I have. I also have just in hearing people talk about how they can be in a waiting room and don't know when they're being called. I realize now that I probably overcompensated for that most of my life, and always tried to sit. When I go someplace, I'm very conscious of figuring out where the doors, where the exits, where, and so it's almost like a hyper vigilance. And yeah, this has all taken a toll on my health, my physical health, as well as my mental health, because I'm constantly being forced to be the one to make an adjustment. The job that I have now is the first time in my entire life that anybody has even asked me, what can we do to make it easier for you to work here? And I'm in my 60s. That was pretty hard.
Anthony speaking. Yes, thank you, Judith. Will, I saw you had your hand up. Did you have your hand up, Will? Oh, no? Okay, okay. Would anyone else like to share their challenges and how it has affected their health? Okay. Well, we will move on to the next question. What do you think the providers need to do differently? And when I say providers, the doctors, the nurses, the medical staff, service providers, what would you like for them to know and how they could, what they could do differently? I saw Michael's hand go up first, and then when Michael's done, we'll go to David. So, Michael? I know one thing that needs to be done differently. If a person, as myself, if I'm having surgery, well, and I did actually have surgery last year. They actually cut my torso open and expected me to hold the VRI while they communicated with me. And here I am in excruciating pain and trying and being forced to accommodate their thoughts of what communication should be. And I could not focus on what was being told to me, especially around the medicine that I was being given for pain and other treatments that were going on post-surgery, because I'm expected to hold this machine in order to communicate. And another thing that the providers typically try to depend on is family members in the room. And I have to constantly tell them that that is not a professional interpreter, and they need to provide the interpreters so I could have access to all communication.
And now, David, if you want to go ahead and go. Thank you for
Okay.
sharing that, Michael.
Okay, thank you. To answer that question, I would say this needs to go all the way back to the very beginning of anybody's medical training. So the doctors, the nurses, and all of the people involved in the hospitals and whatnot, you're in a medical environment. And the deaf community is a medical problem that you should have learned all of this back in your training, to pay attention to people who are hard of hearing and what their needs are. That you should have been instructed by your various professors and whatnot how to address hard of hearing people, to face them, to speak clearly, to not shout. Things like that should be done, and everybody needs to understand that and carry that forward throughout their professional life. That's it.
Anthony speaking. Yes, thank you for sharing that. I do agree. Would anyone else like to share? Okay. We'll move on to the next question. Where do you actually access your healthcare information? And that information, how could it be, what ways could it be found easier? David, I saw his hand. Go ahead.
Okay, that's something I deal with a lot, being the newsletter editor for HLAA, our local chapter. So the internet, of course, is what I reference all the time to do any of my research and things like that, and try to present some of that within the newsletter itself to those who our readers are out there. I think some people are dependent on that to be their source of information coming from the newsletter. But I highly suggest that, of course, the internet is a wealth of information out there. If you know how to do any kind of searching at all, you should be able to find what you're looking for. So we have a great advantage now in our lives during this time in history, that the internet is everything out there for knowledge. So go out there and get it. That's it.
Yes, thank you. Now, Judith.
This is Judith. Yes, I too rely upon the internet for some information, but it can also be a source of a lot of incorrect information. And it's very important for me to make sure that what I'm getting is actually, some good information as opposed to misinformation. So I might have to check it against various different websites, or maybe even ask my doctors, to verify the information. In addition, I read the Heiser newsletter. I have found out some things through that. I also am a member of a couple of different organizations that, like NAMI, the National Alliance on Mental Illness. They may or may not have anything specifically about hearing issues. Maybe that's something they can start doing. I probably never even talked with them about it, and I've been volunteering with them for like 3 years. So I've had a lot on my plate. In addition, there's 2 or 3 other groups like Depression and Bipolar Support Alliance. They have a weekly, several weekly sessions, some in person, some by Zoom. They've been very supportive about all different kinds of health information. And then a lot of it is just, word of mouth, talking with colleagues. Like Holly is on here. There are other people that I work with that I've learned, and even my supervisor who is hearing. I've just learned a lot from being around other folks. I haven't joined any other organizations yet, but I'm sure I will. That's it.
Anthony speaking. Thank you for sharing, Judith. Thank you.
You're welcome.
I see that in the chat that Holly would like to make a comment. So go ahead, Holly. Yes, I don't have any specific health issues, but in general, I know that the deaf community tends to share with each other which doctors are more accessible than others. So yes, the deaf community, a lot of information sharing happens within the community. Now, drawback of that, if you do have some type of heart issue and you need a specialist, that may, then the issue of advocating for yourself comes into play, because you will have to get your interpreter there. But once a doctor is identified as being receptive to providing those services, others in the deaf community tend to go to that doctor as well. Anthony saying, yes, I certainly agree with that. And I've experienced that as well. I see Patrick, you have your hand up.
My doctor that I see regularly as part of a large hospital organization, they have a website you can log in. And so I can see a lot of my health information from my doctor, what he's prescribed and so forth on this website, you know. In addition to that, I'm also, I can log into LabCorp. And when I have labs done, I can see all the results. So that's handy if you're able to do that with your doctor and so forth. Thank you.
Anthony speaking, yes, yes, thank you. Okay, I see Judith, go ahead.
This is Judith. I say yes to a certain extent. My experience has been that more and more the doctors are trying to limit face-to-face contact. And for me, I resist finding out information through my chart or, you know, having online access, because I prefer the face-to-face or hearing a voice. And I think maybe it's kind of similar to how some of the folks on this Zoom call don't like that, like a machine, you know, or an interpreter, you know, that's just, it's just one dimensional and all that, and you can't get any nuance. And plus, like, my connectivity is poor where I live, has nothing to do with anything I can control. So I do not want to rely upon that. And I think that more and more we're being forced to do this. And I spent time in a country that's considered to be, you know, third world or less than. And the way they handled medical issues and the way they treated people was much more advanced than here. People are considered to be human beings first, not a source of income. That's my political point of view.
Anthony speaking, yes, yes, Judith, and thank you for sharing that. Would anyone else like to share on this question before I move on to the next one? Okay, I don't see anyone. Okay, so my next question, and this is specifically for Michael as a cancer survivor. Now, the treatment that you've encountered, how do you think that could have improved? And what other experiences would you like to share in regards to your cancer diagnosis? So yes, my experience, I started chemo back in December. Let me think, December 19th. 2022. So that would be last year. I began chemo treatments intravenously, and I did have an interpreter Monday through Friday. It was several hours a day. And they provided interpreters continuously. I had different portions of the treatment throughout the day, some for a few hours, others were maybe an hour. They were very considerate about my communication access. They made sure that I had the information I needed of the medication that I was being given, if there was any changes, if I had any questions. I mean, they were open and forthcoming, and they were able to do that with the interpreter being there. And in some instances, I was in a room where I had a television. They asked if I would like to have closed caption on. And that was nice for them to think about that. In some situations, I am able to use spoken English on my own, but when the chemo would impact how my voice would sound. So the nurses, we had a great conversation around that, the difference between when I would use my spoken English as opposed to using the interpreter. And with the chemo treatments, each time there was a different medicine given, and they made sure I understood which medicine I was given. And with chemo, it's normal to have a blood transfusion. Sometimes you just bottom out quickly. Your numbers bottom out quickly, and they have to get the transfusion set up and going quickly. And that's why it was very important for me to have the interpreter there. And each time I would have blood work done, the results of that blood work, it would demand a different type of treatment. There was instances when I was sent directly over to the hospital to have the transfusion or some other type of treatment to get my numbers up. And they were very understanding, and they found ways to communicate. They did not make communication a barrier for those things to happen. I did not want to depend on my mother while I was getting chemo treatment. I really I emphasized to them that I wanted my mother there as a caregiver, and she didn't need that role of interpreter. She did not need that role as an interpreter. She is my mother. She's there to provide support. So it was inappropriate for them to depend on her for communication needs. She's there for me while I'm going through this treatment regimen, and while I'm having my different experiences and reactions to the medication. She's there to provide that support, not to be my communication access. And through my experience, I encourage them to think about their other deaf patients that come through the doors, to be more empathetic with them as well. Make sure they have that communication access. Make sure they have the interpreters there in case there is an emergency situation that does come up, and the treatment has to shift to something else to get through that emergency situation. Now, if you don't have an interpreter there, that's time wasted for you to have to call for an interpreter to get there. And that's precious time, especially when it's regarding health matters. So that's why it's very important to have the interpreters there during that time, so communication can happen when it needs to happen.
Thank you for sharing that, Michael. I'm happy that you had a good experience for your chemo, and that you were able to get your communication accesses met.
You are welcome.
Okay, so I just have another question here. Will, you had mentioned that you had epilepsy, or that you currently have epilepsy. Can you share a little bit about your experience with that? Yeah, my first seizure. I don't know the sign for seizure. Oh, okay, there we go, seizure. Okay, so maybe about 6 years ago, I guess, my wife had to call an ambulance. because I had, kind of passed out. I was riding in the ambulance. I didn't have my hearing aids on or anything, and I was just really confused. Like I didn't know where I was. My wife at that time, she was a stay-at-home mom. She was pregnant with our daughter. And so I showed up to the ER and, like I said, completely confused. Finally, they got my dad there. And my wife had called my parents and my dad came. And finally, my dad is the one that said, they asked for CART. And the doctor didn't know what was even wrong with me at that point. There was maybe like a brain bleed, or they didn't know how serious things were at that time. They were doing all these tests to try to figure it out, but they wanted to move very quickly. And again, I still, during all of this, wasn't quite sure what was going on, not quite understanding. Definitely very nervous, definitely nervous about what was happening, not knowing. They finally found that there was a brain bleed. And that was good that I understood that. But then now I can understand that what was happening, I could ask questions and try to figure out what was going on at that point. After that, I would have to go to appointments to like the neurologist, and I had a lot of questions at that point, right? Once I figured out what was wrong, I just wanted to know, like, what were the symptoms? How did this happen? There was just a lot of questions that I needed to make sure that I had good, clear communication for. So I went to the same place often, and they began to understand my needs from then on, right? And the ER, that experience was just, it was tough to say the least. You mentioned that it was a scary experience riding the ambulance. Was it the ambulance service or the EMTs? What part about that was scary? Are you asking me, Anthony? Or are you asking anyone? No, I'm asking you, Will. Well, the EMTs and the ambulance. Okay, so the ambulance, when I woke up from the seizure, I didn't know why I was in the ambulance. I didn't know what had happened or anything. I live about 20 minutes away from the hospital, and on the way is when I was waking up. So I was waking up in the ambulance, and maybe, I guess, I don't know, halfway there or so, I tried to let them know that I was deaf. And, they wanted me to put down what had happened. And I'm like, I don't know what happened. I couldn't really write it down because I still had a lot of questions myself. So that probably was scary because I couldn't really communicate with them in the ambulance. Then, of course, when I got to the ER and my dad shows up, maybe like 30 minutes or so later after I had arrived, right? But again, there was still this confusion from having the seizure and not knowing what had happened. Just very, very confusing. So I don't know what else I could have done in that moment to change it. Yeah, that sounds like a really scary experience, Will. It does. I have another question. Anthony says, deaf or hard of hearing, health advocacy. Who do you think could help navigate through the system? Who could help navigate you through the system? Well, Will says, I had another seizure And my wife now knows to call VRI, the agency, and they'll because I have epilepsy, my wife now knows to call the agency, not the hospital. I mean, she'll call both, but the agency can help faster, much quicker. And so, and plus my wife is hearing. Oh, Anthony says, oh, okay, okay. Anybody else want to share? Deaf or hard of hearing, like a health advocacy or being a health advocate? Is it you that is, you know, trying to help people navigate through the system, the health system? Michael says, I agree. Yeah, they should have advocates out there to help navigate through the health system, right? I mean, it's really about the education. Better education would help for deaf and hard of hearing, right? I think that the community as a whole could, you know, be supported by the advocacy, knowing about interpreting access or the different modes of communication that people use. I don't know. I guess the key would be around that communication piece. Access to communication, access to everything that they need. It's not only the talking, it's the information sharing as well, right? What's going on with them as a patient. As like me, myself, with my experience, I would think that like every time I go to the doctor or the hospital, every time I like to make sure that an interpreter will be there. If no interpreter will be there, then I have to find another way to communicate. Because if they can't give me an interpreter, then I'm going to have to call directly to the agency to see if the hospital may have forgotten to call over to the agency, right? So, or I have to give the hospital the agency's number so they can call over to the agency to get an interpreter in person so I can have that access. That's one thing, like I said, I'm always emphasizing to the healthcare staff, call the interpreter. It doesn't matter, deaf, hard of hearing, call for the access, give them the access. And so I guess, you know, I don't know a better way that we can share those kinds of tips with them, you know. Thank you all for sharing some of those resources that you've used. I'm sure that that will be a benefit to those on the call. Anybody else wanted to share? David.
You know, there's a lot of new technology out there that just more or less produces closed captioning for you right on your phone by just using the phone as a transcriber for people speaking to you. I know I don't need that for myself personally, but those of you who have no hearing, are you not using those at all? Are you always dependent on ASL people to be present for you? Can you not use your phone and get the closed captioning on your phone?
Are you asking any, I guess he's saying, are you asking anyone in the room, David? This is Anthony. Are you asking me specifically?
Actually, everybody in the room, but mainly those who are not, you know, who do not have any hearing at all.
Who wants to answer that? Anthony says, Michael. Sometimes I've tried it. It just doesn't always work. the download, the feed can be a little slow. So we'll, you know, waiting for that to come through. Yeah, I've had some trouble there. Trying to discern the different voices, also trying to understand what's going on the caption on the phone sometimes takes longer to figure out, because I've got to wait to read that they're done talking and okay, now it's my turn. And it's like, okay, so it doesn't flow as smooth as it should sometimes that way, that communication. So it's easier sometimes to depend on the interpreter and not on the phone for me. Being at the doctor's office one time, maybe like a month or two ago, and the phone was not working for me. So I just turned it off. I was like, this isn't working, it's not working. So I just turned it off. So I took my mask off. And at that time, I wanted to be sure that there was going to be an interpreter there, right? So that.
The doctor was willing to take his mask off and we communicated in that manner. And then I made sure for the next appointment that we had the interpreter there for the communication.
Okay, Will, Anthony says, well, really, it depends on the situation. You know, depends on the social setting and everything. If it's a big group, sometimes it's going to be hard to hear that well, right? So looking at the caption could be more helpful in a situation like that, but being one-on-one seems to be fine. I really think it would depend. Really what the important part is using an interpreter versus using the CART services, captioning CART services. Anthony says, okay, Judith.
I think that because my hearing aid uses Bluetooth, I have to have my phone with me all the time if it's going to work, because that's the way to adjust the volume. And sometimes I will like type out something on the phone and show it to people or something if I'm having a really hard time, like either in text or in I think it's notes. There's an app on an iPhone where you can just write stuff. And we do that at work sometimes with each other too. So, and so this is a mental health setting, but yeah, but the phones have ended up being a really important way to communicate medical or health information or other concerns for that matter.
Thank you, Judith, for sharing. Let's see. Laura, then Patrick.
I wanted to, sorry, this is Laura, and I wanted to briefly go back to something that Anthony had mentioned earlier in regards to use of advocates in accessing healthcare and or social services. Part of our coming together as a community impact council, we began working with the Kentucky Office of Community Health Workers. And they are a group. A community health worker is a frontline public health worker who works to be a trusted member within a group to help them access services. They work to facilitate and improve the quality and cultural competency of service delivery in various fields in various communities. And what we learned from them is they do not currently have anyone who is trained in American Sign Language or have the training capabilities yet, but are interested in looking how they might move forward in that. And so my question with that is, when we think about that advocate, would it be beneficial for you all? Would you see you or other community members in the deaf and hard of hearing population use an advocate who could help you navigate those systems? And hope that Holly.
Yes, I think that would be beneficial if we could do that. Like if we had, if we could spread the word to the community, right? Word of mouth, advertise it in a way that it would be a positive experience. I think that would be very, very beneficial, right? And I think that people would use it.
Great. That was the only other question that I had, Anthony. And was it David or Pat that had a statement they were going to share? I thought I saw one of your hands up. I'm sorry.
Pat, we were talking about advocates, but when you have a hearing loss person and you ask for an advocate, the problem is a person who uses ASL comes up, and a lot of us, maybe most of us, don't really understand sign language. So it's the wrong person, so it comes up. I don't know, my experience was, for an example, the idea of the doctor's rounds. When I was in the hospital, it was like 2 weeks, and I'm like lying there with a broken back, wondering what they're going to do for me, you know. And I don't know how many times I missed the doctor coming around for his rounds, or to speak. Finally, 5 of them showed up, and now we finally got to talking about, what are you going to do? Are you going to fix me or not? You know, so I don't know. That's all I have.
Anybody else want to share related to that question that Laura asked? Sure, Holly. Holly says, I agree with the HLLA because you all know more about your experience than we do as deaf signing people. So I think it would be very interesting, because Judith now is here, and now that she showed up, she has brought up some very interesting points with her experiences. For example, like in the break room at work, it's super loud in there. I can't hear everything that's going on in there. It's so loud, right? And so it's important that we have someone that has a similar experience, right? So thank you, Patrick, for, pointing that out about the advocacy work. Thank you. Anthony says, oh, last comment. Oh, yeah, Judith, go ahead. You can share before we get, wrap up here.
I just wanted to say to Holly, thank you for saying that. I think it's true. And I think there will be many more people like me that are starting to lose their hearing, either not for the same reasons, but as they age. And also as technology is improving so that people can be diagnosed with hearing loss and maybe even have hearing aids. So it's important to be on the front edge of this and be ahead of it before, as opposed to like stumbling through like I've been. I'm glad to be around other people who've already paved the way. Thank you.
Okay, thank you there, Judith. Okay, so now we have our final question before we wrap up. And that looks like what? What is something that we haven't discussed today that you were hoping that would come up today? Or any final thoughts that you would like to share? Will says, I just want to say thank you. I want to say thank you for all of you all bringing your experiences here to the table today. The positive, the negative, right? It's just good to know that you know, there is a connection here. That's just really good to know.
Anthony speaking. Would anyone else like to share? Yes, David, go ahead.
For those of you who may not know about the local chapter for HLAA, we meet the second Tuesday of every month, except for next month. We're going to have a Christmas dinner for next month. But starting in January, back on the second Tuesday of every month at 6:30 at the Northeast Public Library over here in the Linden area is where we have our meetings. We have a loop system that's in that library, so you'd be able to use a loop, and we also have sign language that is available for you, and there's also a CART person who's there all the time putting up the closed captioning. So if you wish to attend any of our meetings where we try to help those who need some self-advocacy help and just maybe talk with others in the group to get their own experiences and whatnot, just to share in the deaf community. Just come on out to the meetings every on the second Tuesday of each month. Northeast Public Library, 6:30. Thank you.
Anthony speaking. Thank you, David, for sharing that information. Sure do appreciate that. Would anybody else like to share their final thoughts or anything before we wrap up? If there's nothing, that's okay. Laura, would you like to say anything before we close up?
Just on behalf of the Community Impact Council, we thank you all so much for being here today, giving us your time and sharing your stories with us. And we'll be sure to follow up and let you know how we're using this information in the future. So thank you all.
Sounds good. Thank you.
Thank you.
Bye-bye. And you all have a wonderful